afternoon and welcome to Future State. Industry leaders discuss today's priorities and tomorrow's challenges. A health system CIO Media Inc. production. Just a little housekeeping before we get started. My name's Anthony Guerra. I'm the editor in chief of Health Systems CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Nice way to view the screen. Click on the top center, get it in side-by-side mode. Then you can adjust the divider to get the slides and the video boxes the size you want them. And it should say speaker view in the top right-hand corner. Just so you see how we're going to spend our time today, first we're going to go about 35 minutes with our main panel discussion featuring Omer Awan, Chief Data and Digital Officer with Atrium Health, Dr. Samir Badlani, Chief Digital Officer and EVP for Technology Services at Fairview Health Services, and I will be your moderator. And then we'll have our audience Q&A. So let's jump right in. We're going to have a fun conversation here. Please give us an overview of your organization and role. Omer, can we start with you?
Yes, of course. It's my pleasure to be here. Would love to share some insights and get your feedback. So I'm part of the Atrium Health Organization. We are based in Charlotte. We are about 38 hospitals across the Carolinas, North and South, in Georgia, including the recent addition of Wake Forest Medical School and Health System and Floyd Health in Rome, Georgia. We are about 71,000 plus teammates and serving a combined population of about 7 million people. We are one of the top six largest health systems with an integrated medical school or major school affiliation. And our mission is to improve health, elevate hope, and advance healing for all. My role is that of a chief data and digital officer. And so I've got responsibility for data and analytics. And in terms of digital in IT-driven initiatives in the consumer experience and digital health space, including virtual health, on all the technologies interacting with the consumer, both internal and external, and also working with the innovation team and the partnership teams in terms of disruptive technologies and bringing them to bear.
Very good. Very good. Samir?
Good morning, good afternoon. Delighted to be here. Samir Badlani. I'm a physician by background. Currently serve as the Chief Digital Officer and EVP for Technologies for mHealth Fairview. We are based out of Minnesota, about 10 hospitals, serve about 1.1 million patients. It's a combination, joint collaborative between University of Minnesota and Fairview Health. So it's both academic and community-based hospitals across the state. My role is a bunch of things. So as the title notes, Chief Digital Officer and EVP for Technology. So it's a combination of CIO and CDO roles. Also have the privilege of leading the cybersecurity function, data analytics, informatics, marketing experience and design, co-partner with our chief marketing officer to run our digital design studio. So it's a fun job and I'm delighted to be serving in this role.
Very good. Thank you. All right. Next question. Samir, let's start with you. What do you see as the main trends healthcare IT leaders need to be positioning their organizations to handle? And what is your advice for doing so?
Sure. I think there are two or three things that come to mind. The digital transformation is finally getting real. For almost 5-6 years, I'd be interested what Omer thinks of this, but for the last 5-6 years, or maybe even more, digital meant putting an app in front of a patient and then calling yourself digital. But the rest of the experience was still very brick and mortar, not consumer focused, and really leverage data and analytics. So COVID has definitely pushed the needle on that. And a lot of organizations are trying to understand where they stand in this new reality. The way I describe it, healthcare is going to go through a rapid change where over the next 5 years, there will be a cross-section of Amazonification and Uberization of healthcare, and you have to find where you sit there. So many healthcare organizations try to be everything to everybody. We are working hard to understand what this means to us, how does this fit in with our strategy. So it's not just the digital transformation. IT leaders will have to get comfortable being co-pilots of organizational business strategy as well. And then the third biggest trend, which I think a lot of us will resonate, is the cyber risk that is just exploded in the last, I would say 2 years, and at minimum is 4x of what it used to be before. So this is real. People will have to really look at this as a core skill versus an add-on you do on the side, and it's going to consume a lot of money, mindset, and bandwidth.
Samir, is a follow-up. You mentioned Amazon and Uber, I believe.
Yeah.
So obviously, if are they the models of what we want to be, and it can't be just as simple as watching them and saying okay and replicating what they do. Is it? Is it that simple?
No, it's not that simple. And the terms I used, just to repeat them, are Amazonification and Uberization. And you see different. So look at primary care, for example. The people we used to look at were One Medical as an example, really, efficient, consumer-driven, boutique type of care, and they're still doing very well. But then you have all these others like Babylon 98.6 and many others who are coming in with a lot of private equity funds, are digitally native and looking at convenience and frictionless experience that's driven by digital and data to really take over the market share of our patients. And then they also think like retailers. And what retailers are very good at is upselling and cross-selling. And typically in healthcare, especially coming from a doctor, that would be frowned upon. That what are you talking about? In our world, upselling and cross-selling are closing more clinical and quality gaps. A very simple example, if somebody comes in for a knee pain, we get very happy if we're able to schedule them on time, get them in, fix their pain, they give us a good patient satisfaction score, and everybody starts high-fiving. A retailer with a Amazonification or a Uberization mindset would never think like that. First, they would try to figure out, why do I need to even bring this patient in? Can I take care of them in their home environment? Secondly, they would think, what else can I do for this patient? So in my context, I'll put myself on the spotlight. If I go in for foot pain, it should not just be about foot pain. They should make sure that any labs I'm due on get done in the same visit. Any scheduling I need to do, let's say for a colonoscopy, get scheduled in the visit. Any other behavioral lifestyle changes that need to be added on get handled in the same interaction. One very interesting example that I heard through a colleague of mine who does strategy work in Texas is CVS Health is getting into urgent care. And when questioned, why do you think you can do urgent care? It's very different from, they're getting into chronic care. They're already in urgent care. My apologies. So when asked them, chronic care is very different from urgent care. What do you think you will be able to offer there? The retort from CVS, very interestingly and appropriately, was, well, we see your diabetic patient 9 times in our CVS pharmacy a month. You're lucky if you see your patient 3 times a year, if that. So what IT leaders have to really understand is, how do you take digital assets and you complement the face-to-face visits with more touch points so that you can upsell, cross-sell, or in our world, close more clinical and quality gaps and earn the right to continue being the primary care provider in every possible way for what our patients need.
Very good, Omer.
Yes, absolutely. So from a trends perspective, there's several in the market that I can point out, but I completely agree with Samir. One, first and foremost, the consumerization and personalization. And to take the point that you and Samir were just talking about, taking it to the next level is, with Amazonification, like Samir was mentioning, we can receive goods the same day we order them. And not only that, we can track them minute by minute from the placement to delivery. So it's not surprising that the patient expects the same high level of efficiency and transparency from our healthcare providers. And still, we have healthcare systems um, and where we have patients that may have to wait weeks or months for an appointment and have only a vague idea of when their exam results will be available. So it's so that's one. I think intertwined with that is personalization aspect. So wanted to share something that I dabbled upon just last week was, and Deloitte in their survey mentioned that an ideal healthcare experience actually requires a personal touch, whether that encounter occurs virtually or in person. So personalization is important, even if I think even if a person is interacting virtually with the healthcare system, to make them feel that we know them. So if they're on a specific care journey, like say on a cancer journey, rehab, it should give them the impression, it should make them feel we know you, and present with relevant information rather than having them to serve through a gamut of things or a canned approach. The second one, I think, which is becoming more and more, and like somebody was mentioning about the pandemic has really brought it to focus, is virtual care. And we continue to see the emergence of virtual care solutions across the care continuum, from telehealth visits to virtual hospitals. You touched on home-based care, remote patient monitoring, all of that. Again, just wanted to share, this was an eye-opener for me. I knew that during the pandemic, we saw new heights of virtual care, but I didn't really see these numbers, and just want to share from AHPHA, American Hospital Association. They just said that health systems believe that they're up to 40%, that up to 40% of primary care visits actually can be done virtually. Um, and now they're noticing that patients actually their willingness to opt for virtual care telemedicine has increased to like up to 66%. So the growth that we saw in this virtual care during the pandemic, I think it's something that's going to continue to grow. So that's a trend we're going to watch clearly as well. And tightly intertwined with what we are also noticing when we talk about telehealth, kind of a subcategory, is the greater focus on mental and behavioral health. So the pandemic has exposed the mental health crisis that our nation has long been facing, and especially because the inadequate resources that are devoted to it, a lot of reliance is on technology. And again, quoting AHA, they mentioned that 70% of behavioral health providers reported that they plan to continue offering telehealth services post-pandemic. Second last is this whole gamut of predictive analytics, artificial intelligence, and automation. I mean, all of those things, they bring tremendous value that cannot be undermined. And lastly, just want to, it's true to a lot of organizations, including ours, which is heightened attention to health equity. So now the pandemic has again placed a spotlight on this aspect as well. And I think we feel that data analytics is a very powerful asset in this space and can single-handedly uncover organizations' performance and help bridge gaps.
Very good. You mentioned the idea of patients having to wait weeks for an appointment. Um, that made me think of where the digital world meets the underlying processes of the health system. There are some problems that you can identify and you can create the tools, but if the underlying workflow and capacity and staffing isn't there, it doesn't matter how great the scheduling tool is if the appointments don't exist, right? So do you find as a digital leader that sometimes your ambitions and your goals hit the underlying workflow and that's where the buck stops, so to speak, and you can't go further until the organization does things from an operational point of view?
You're spot on with that. So it requires so bringing about those changes, right? You have to think through the entire process. It cannot be very episodic. You have to think of the foundational operations that will support those. So that does require a lot of, I mean, a cultural change at minimum, but requires a lot of working with operational leaders. So we, like in the virtual healthcare space, we work very tightly with our virtual healthcare leadership, non-IS, non-IT, to make sure that we've got those processes that are aligned and supportive of what we do. So, and that really helps. Just to share with you just a few things that resonate. during the pandemic, and still we continue to see a great deal of visits. We noticed about 44% of our urgent care visits actually transformed into virtual care visits. And about 35% of the office visits were replaced by virtual visits as well. But that wouldn't have been possible if we didn't have the supporting processes behind the scenes.
Samir, do you have any thoughts on my question about as far as getting that underlying operational element to change to make it the digital transformation work better?
Yeah, absolutely. So, couple of thoughts there. One, you're right in the way Omer responded. Digital is as much about cultural and operational change. And honestly, it's about 30% about deploying technology. The rest is all workflow, business case, and mindset. The second thing that digital and fundamentally why it's different from the technology modernization or digitization of about 2 decades ago is you really start looking for a virtuous cycle instead of looking at everything as a linear, factory model, do your warehouse, do your storefront, and then reaching your consumer. Almost anything can become a value add service. And in this case, if you look at telehealth, what I'm sure Omer's organization must have also done during the COVID time is we rapidly increased our asynchronous care models. So pre-diagnosis and post-diagnosis with COVID, we were able to handle a lot more patients using our platform services, Zipnosis on the front end and Get Well Loop on the back end, on the latter end, not the back end, where we were able to handle almost 2,000, 3,000 patients a day, pre-diagnosis and post-diagnosis without any significant human involvement. So if every time we put out a digital solution that requires an equal effort by humans on the other side, we should stop right there. That's not digital. That's just, fanciful thinking that putting, an Apple product in a workflow or something like that makes it innovative. That's what we were all, succumbing to a few years ago. So really thinking about, I'm going to put this service out there and how can I have significant automation behind it? And how can I not involve a doctor or a nurse unless absolutely necessary for either the experience or the decision making should be, checks that we hold ourselves accountable to.
Samir, the idea is to push digital first, right? And to create a digital push people to handle their business with the health system in a digital fashion and to keep them in that digital world as much as possible without a human touch. It's efficient, right?
Right.
But we know in our own personal lives, in our interactions with many organizations, that there's probably nothing worse than being pushed into a digital engagement that doesn't work.
Right.
I mean, phone trees, voice recognition that doesn't work, can't get a human being on the phone, can be extremely frustrating. So there is a high cost to rolling this stuff out and getting it wrong in terms of user frustration. So what are your thoughts around that?
It's a great question, Anthony. I think the biggest fallacy about digital is it's about zero human interaction. No, it's about appropriate human interaction for the appropriate use cases. And that's why my colleague Scott Weber and I together, we partnered on launching our design studio because being a digital leader in your organization, like I said, has probably 30% to do with technology. The other 30% is about the consumer experience. So if you are not designing the correct experience and launching technology tools, you're bound to have situations like you spoke about. So when I choose to not have human interaction, and when I choose to have human interactions are my choices, all digital does is it creates a level of convenience and frictionless use of an asset that it leads to me being happy. And digital is not just about what faces your consumers. Digital is as much about your back office or your shared business services. I'm a big proponent of, boring projects that are related to automation and probably don't make any publication out there, but there are so many things behind the scenes that we do in healthcare that are repetitive, that are very labor intensive, and lead to a lot of inconsistencies because of the way it's been designed that lend themselves to digital transformation. So when I think of my role, I try to think equal parts about the clinical, but then another part about the the financial or the operational side of running a large business like healthcare. Supply chain, rev cycle, call centers, all of them are fair game. And there are so many examples you can look at. My favorite one to analyze is Delta, the airlines. And they decided that flying in a plane is going to suck no matter what. You can only make that as much better. After a stage in life, you're too fat for any chair, your back is too old for any reclining anything. But it's the pre and post elements of being in a plane journey that they are really spending significant time thinking about how to design it and using their app to make it better. And I would suggest next time you go on a flight, look at what that experience is like and how that changes every 6 months. That's where we can learn a lot of lessons, with what Delta is doing and what we can do differently.
Very good. Omer, as I mentioned, nothing is better than a good digital interaction, right? I just feel so efficient and clean. Nothing is worse than a bad digital interaction when it's going badly and you still can't get a person on the phone. How do you make sure that the things that ultimately get rolled out and become public facing and for the public use are ready for prime time?
So it's a great question, and I want to echo most of the thoughts that Samir shared as well, because at the end of the day, we want to make sure that all our experiences or the technologies that we're going to roll out, the central focus is the patient, the consumer, and they're all centered around it. So we have to envision that, whether it's a test in the lab or some prototyping, but that is at the heart of it. One thing I do want to share is that, in terms of also AI, ML, there's a lot of data, and especially if we are trying to train the predictive models, there's a lot of emphasis nowadays on that space. We try to train those predictive models on the data from the organization so that it's close to the experience, it's replicating and producing the outputs that are relevant to the organization, but we don't have enough data on the humans, and we are never training those around the human interaction, how humans will interact with the outcomes, the output. And so that has been a topic of debate with among the pundits and gurus of AI, ML, that we don't have enough human data. We never really captured human interaction data with the application of the digital side of the house.
Mm-hmm.
We've been always very focused on this is the experience, we want to digitize it, but never how does a human interact? How do they present it with this? What are the behaviors that come forward? What are the attitudes? I mean, what should happen there? So I think we are evolving, and so the fact that these discussions are happening, the experiences that will come forward will be much more in line with user expectations. But nevertheless, I think the key from our perspective is also experimentation, building verticals in the sandbox. You have to test and try. There is no cookie cutter approach. And so you have to do as much as you can, unless we reach that point where we have more data that we can bring to bear.
Very good. Samir, talk to me about any kind of sequence of how this stuff is supposed to work. As far as when a need is identified, what do we want to do? What do we want to digitize? There's a million things we can select from a million projects. Who's deciding? Are you deciding? What's the governance process that works to help identify what we're going to try and tackle? So how does that work in your health system? Right now, you have a portfolio of things you're working on. Why those things? How did they get selected? Take me through that process a little bit.
Sure. First of all, I'll admit that it's not a perfect process. We have had so many curveballs, fastballs thrown at us over the last 3 years that it would be foolish to think that we have this clean process. There's an entry point, there's an analysis phase, and then there is a decision-making phase, and off you go. We are reattempting that in my organization to bring better focus, and all of us in senior leadership are leaning in. The way I think of my work is in three or four large buckets. Obviously, as a technology leader, I have to make sure there is infrastructure resiliency and cyber resiliency. So, think of it from a Maslow scale going from bottom to up. There are some basic needs around operations, network to keep the system running that we have to keep, the care and feeding of it going. What we try to do is, along with life cycle maintenance, we look for leapfrogging opportunities. Because something was delayed by 2 years, let's not try to replace it what we should have done 2 years ago, but let's try to replace it with what we need 2 years from now. So there is that future outlook that we are trying to bring into our organization. Beyond that, there is a layer of how do you build intelligence and experience capabilities in our ecosystem. So that's the second bucket that we are looking at, of having a steady level of investment in. We're not a CVS, we're not, a Google. I can't throw $1 billion on an idea and have no worries whether it sticks or not. Healthcare is a -2 to a +2% margin business for most companies. So we have to be very thoughtful, frugal, and purposeful where we put in our dollars. I try to remind myself and my team that every dollar we spend on my salary, on anybody's salary, is coming from clinical care. And if we don't have a very good use for it, think about how much you could do for the community in a free clinic, as an example. So that's the level of self-reflection I like to do. The third thing is really have a business lens on it. So is this project going to improve my customer acquisition, or going to improve the share of care I have with a particular customer? Like I spoke about before, you come to me for your diabetic care, can I earn your business for your primary care? You come for me for primary care, can I earn your business for your rheumatology work as well? The second is improving the experience of the patient and navigation once they are in our ecosystem. How long does it take to get a follow-up? What is our communication style to you when you call our help desk? Not just how quickly we pick up the phone, but do we remember why you called last time? Think Delta. They know exactly what I called for last time within seconds, and what I potentially need based on what they know about me. The fourth bucket is around thinking of platforms, really looking at areas like automation, CRM, data analytics. How do you keep building those up? Those are not overnight investments. And if you try to make it overnight, then the cost to value is too lopsided. And then the final one is always thinking about how to turn digital into a P&L on its own. Right now, digital is an enabler. For me, success would be that in X number of years, digital can stand on its own as a P&L. And when you looked at the explosion of virtual care, asynchronous care during COVID, that was the first real world example that digital can be its own P&L. So those are the ways that we try to break up our work.
Very good. Omer, thoughts around governance and how projects do or should get selected and move forward in this area where there's a million things to pick from?
So from our perspective, you can look at it in two broad categories. That's what we employ. One is that we have a very good relationship with service line, all the service lines. So when I say service line, I also mean like, clinical areas. I'm talking about supply chain management, like somebody was talking back office things, all of the service line. And what we want to make sure is they also know that if there are needs that arise in their areas, there's opportunities to digitize certain areas or all of their areas maybe, that they interlock with us, and that transforms into projects. And then we take those projects through our governance. And that's in the governance structure, that's where we reflect them thoroughly in terms of the value to the organization, the ROI, the time it takes to get that ROI, and all those kind of things. So that's one way. The other way is also that, as I alluded to earlier, working very tightly with our innovation team and our partnership team. So many times we've got these very novel ideas coming because they keep doing the horizon scanning in terms of what's transpiring in the industry. what are the new disruptive technologies, and new value solutions that our service lines may not know about. And so that path helps us then take those ideas back to our in different areas, clinical and business, to share with them. And then collectively brainstorm and see if there is value there. We are very problem focused. So we always want to make sure that we're trying to solve for something and that we do not, you know, get dragged into that SOS or shiny object syndrome. We just want to make sure that we are focused, always trying to solve something. So those are the two areas, and that's the two doors into our, you may say, the to build a list of digital projects, and then they go through the governance and vet it thoroughly before they're sanctioned, and we can take them on.
Very good. So, Samir, would you say it's, and I think you hinted at this, that it happens all different ways. It's not a super clean, one size fits all process of here's where ideas come from and here's what happens. Ideas can come from you in terms of a top down, they could come from your innovation department, or they could come up from the actual department that ultimately is the operational department and would be using it, right? They could have the idea and say, hey, we
Right.
would like to do this. So it can come up from them, come down from you, over from innovation. So then it has to be analyzed and perhaps put through a governance process. Is this something we want to do? And then after that, it's got to be coordinated across the department. Security has to be brought in. And then the department that will ultimately be using it has to be brought on board, which would vary in terms of how that's done, depending on whether or not they originated the idea. If they originated the idea, much more likely they're going to be on board. If they did not originate it, if it was brought from somewhere else and but they have to carry it out, might have to be handled a little differently. Am I at all on track with how some of this stuff goes?
Yeah, mostly I would say you would be surprised even if the idea came from a certain department, how uh, how much time and effort it takes to do the change management,
Mm-hmm.
because an idea may come from an individual in a department but moves the cheese of the entire workforce. So you have to look at it that way. One of the common challenges is that somebody wants to put in a new workflow or a new data collection, and immediately it does not benefit everybody in that group. So why would they want to do it? It's an extra training for everybody. One of my favorite examples is when Apple Watch first came out 7, 8 years ago. We had strong support to use it in our diabetic clinic. And we were like, yeah, this makes sense. It's an amazing piece of new technology. Let's get behind it. We put in all the effort. Turned out it was only one clinician who was interested. None of his patients signed up, and the three people who signed up were the clinic staff. So, the change management is not just cross-functional; it's within your ecosystem as well. And what we try to balance is, do we have X number of projects that are absolutely necessary for, on the Maslow scale, another group of projects that are there for business growth and clinical and safety targets, but then always try to leave some bandwidth for innovation, experiments, and like Omer said, have the service lines decide, who gets priority, because I don't care which organization you are, you can never have enough money and enough time to do everything that comes your way. And the metric behind a good governance process is when you are saying no to good ideas.
Mm-hmm.
If you are just saying no to bad ideas, that's not governance. You really have to get focused. And many companies out there outside healthcare, General Mills is a great example. The CIO there is a esteemed colleague, and he shares how IT department will do a certain set of activities, and then they have X amount of dollars and time to do growth projects. And then the business competes amongst themselves, almost like a Shark Tank, and says, this year the yogurt division wins because their project is a better idea or has all the appropriate business ROI. And then they're supposed to come back and prove that by using technology and organizational change management bandwidth, they were able to get that result. And that counts as their score for next year's process. And I would love to get there in my own ecosystem. We're not there yet. We are really bad in healthcare and look back. We just move on to the next idea and really don't think about why did I do what I did, what did I learn from there. And agile, as a PM mindset goes in that direction, but the patience and the diligence to do a look back on all the projects done last year, it's a big cultural change for anybody.
Omer, would you say you have to be comfortable in this position with everything not being black and white and based on pure data in terms of projects, which projects to do, when to do them, when they worked, when they haven't worked? Do you have to be comfortable with a lot of gray and ambiguity and feeling? And it sounds like that. It sounds like it's not, pure black and white, pure by the numbers.
So great point. So I mean, you try as much as you can to have data-driven decision making and help you do that. But the reality of the matter is that we are learning more and more how to operate effectively in this era of ambiguity because not everything may be very crystal clear. One other thing related to your question, I think, is also being able to be flexible and being able to pivot is another key thing. So, like, all these initiatives that are going on at any given time, but then all of a sudden you just need to pause them, especially like for right now is a good case. I mean, we're seeing these spikes because of this Delta variant. So everyone is pitching in, rolling up their sleeves, even if you're not clinical, to help out and as maybe runners or in different capacities. Well, that puts a pause on other things, but then that means when you pick them up, you need to be able to go after them with more agility, and so that you're right. And then many times the landscape is changing as well, right around us. So we have to be able to pivot. That's important.
Yeah, I just want to, it just sounds like that's an important element in this role and in this type of work is to be flexible and nuanced and that just to me is interesting. Samir, let's go to the next question with you. What are the top 2 or 3 large projects you're working on and the main challenges you're seeing with those projects?
Yeah, the first one that comes to mind is expanding our digital front door. We've been working hard for the last year to use design and consumer journeys to recreate our app and web-based assets. And now the chassis is built, the basic functionality is here. So how do we take it to the next level and make it more purposeful? Because as anybody knows, within the digital front door, you can do almost 10, 15 different things. But which one of those in our environment for our group of consumers will lead to the best outcome for our company? And to your earlier point, don't want to create a digital front door that brings in a lot of seekers, but then our environmental operational bandwidth cannot meet it. So it's balancing the digital front door and access at the same time is what we are working on. And obviously there are layers of, do I really need to bring this patient in, or can I take care of them asynchronously or synchronously through a digital asset? So that's one that is big. The second one is more around the shared service, which is around analytics and automation. We have spent about a year kicking the tires on it, understanding how it may not work in our environment. And in 2022, we are going to really take it up many notches and want to make sure that we have at least 50 to 100 digital workers that are reducing the burden on our human FTEs. And the goal here, or the marker of success, is not how many FTEs we can reduce. I think that's the biggest pitfall of any automation project, is if you think your desired goal is less people working for you. Our desired goal is to have those people be more efficient and work on more complicated cases that require human interaction. So, your example of, I want to speak to a human, if you are calling about a bill and you have a $25 problem, the system should be able to pick up, most likely Samir's calling about this $25 charge. Can I waive it as part of my framework? And I've been through these cases where a credit card company will say, are you calling about the $25 late charge? Click one yes. Would you like us to waive it? Sure. And I'm done. And I couldn't be happier. I don't want to speak to anybody. But if I have like 7 charges, one I want to dispute, that's when I don't want to speak to a computer. I want to speak with a human. So the system automatically having that work done is a great example. On the clinical side, the in basket is the bane of every clinician's existence. So we are going to be doing a lot of work in partnership with Epic, how to use automation in the in basket so that as a clinician, I'm only responding to messages that require clinical input. Messages like, hey, I need an appointment. What are the side effects of Lipitor? 85% of those messages no human should be touching anywhere, and you can have a quick response. So we'll be working a lot on the user experience. So we talked a lot today about the consumer experience. I'm pretty sure Omer and his company are also working on the employee experience. I want technology to be such a friction-free and delightful experience that people choose to come and work for us, not just because of what they make or the mission, but their experience in using technology.
Very good. Omer, top projects?
Yeah, so I would have to say that some of the things that Samir mentioned keep us busy as well in terms of our top priorities, like the consumer front door. We continue to enhance it because that's the gateway, and we talked earlier about Amazonification, and so that becomes front and center. Our mobile application, our web interface, and we continue to enhance it, and finding up new more capabilities to more personalize it. So lots of initiative in really taking it to the next level, including the chat bots, trying to see how we can automate a lot of it, like Samir was alluding to the extent that it doesn't become cumbersome or bothersome for the consumer, and what's the right time when we switch over to a real person. All those things happening around in that gamut of things. The other big area under the, I would say, consumer experience and digital health is all our key initiatives under what we call enterprise voice of the consumer. Because at the end of the day, it's about the consumer, right? So we want to make sure that we capture the feedback that we're getting from the consumer, whether it's through the surveys or whether it's online, trying to assimilate it and use that to drive our future actions. A lot of strategies there. Virtual health, we continue to, all these are kind of under the digital health umbrella. So virtual health, we keep on enhancing. Today, we offer virtual health capabilities, not just in the inpatient, but care at home, remote patient monitoring, the entire continuum of patient care. But we continue to enhance it so it becomes more personalized and easy for the users. Automation, I think somebody was mentioning this earlier. We see a lot of value, so we are really looking into this very seriously in terms of applying like robotic process automation or RPA, how we can digitize and automate some of those repetitive and mundane tasks behind the scenes that really can be easily done or can be easily emulated by software. Emulate human actions through the software. So looking at different areas like supply chain management, a lot of opportunities, revenue cycle management, tremendous opportunities there, especially in today's age when efficiency is key. And then we have a lot of initiatives currently that you may lump under the data and analytics. And so we are very high level. We are trying to stand up our data governance. So we already had data governance, and depending on who you ask, right, if you may get different answers. But from our perspective, data governance is a perpetual new line of operation, especially now that we have been integrating with other healthcare organizations, more specifically our teammates with Wake Forest, and that adds a new dimension to us in terms of research and academic data. So we want to make sure that our governance has the capability and can be enterprise-wide. And then we are marching forward onto this AMAM model from HIMSS, AMAM Analytics Maturity and Adoption Model. So we're trying to move towards a maturity there, and part of that is also implementing a master data management solution. So those are some key big things that we're working on.
Excellent. All right, let's do our Ask a Co-Panelist feature. Omer, do you have a question for Samir?
Yeah, this is this is in line with what we've been talking. So I want to definitely get Samir's thoughts. That in today's age, in this pandemic age, what we see is a lot of organizations focusing on really solving problems and don't seem to have as much appetite to do experiments or to, dabble into these innovative technologies or disruptive technologies, because the proven ROI may not be there. You ask those organizations, they feel experimentation is necessary because of their future viability. But then you've got others who don't have the appetite to do that because of their losses. So what are your thoughts? I mean, what's the way forward? How do you see it? Foot in both areas, or pick one, or what are your thoughts?
Yeah, great question. Um, a few things. As I mentioned earlier, healthcare is a very narrow margin business. So you have to be very pragmatic about how much experimentation and how much, you know, disruptive technologies as a buzzword can you really bring into. However, it does not have to be super expensive or have multi-million dollar, outlays. One of the ways where I've tried to balance that is in partnership with startups where, they are doing much of that disruption or analysis of new technology. And what we provide is thought leadership, subject matter expertise, and an environment where some of these things can be tested out. I mean, if you go back a decade, having your own innovation lab with multi-million dollar pay to play type of outlays used to be the trend. I think many of us have learned that's not our core skill set. We need to focus on slightly different areas, but we can partner. So partnership is a model that I really like to do some of what you're asking. But then at the same time, you really have to be good as a senior executive to understand the way the wind is blowing in your organization. If you are, for example, fighting the fourth peak of COVID, and you show up in a senior meeting, hey, look at this new robotic tool I ran into, and I'm going to spend 2 days working on this, whereas everybody is putting extra shifts to fight COVID, that will land pretty bad for you, as it should. So really understanding the timing and where you put that effort in is important. And then finally, experimentation by its nature happens a lot from an agile mindset, especially in the experience layer you're building in the organization. So I think if done for the right kind of gaps, done in the right kind of guardrails, you can still create a culture of innovation and transformation. Finally, I've always had this mindset that innovation without translation at scale is a very expensive science hobby. So I'm always trying to push that, okay, it's great to be innovative, but how much of that really translates into your organization or somebody else's doesn't have to be in your own organization. So we have to be very clear about the motive. It shouldn't be innovation for the sake of calling oneself innovative. It could be for creation of non-core revenue. It could be for, assessing disruptive ways to solve problems that you haven't been able to solve, but really understanding why am I going to engage in this 6-month project with exit and with entry and exit criteria predefined is a good way to create, a mindset around it.
That's great.
Very
Thank
good.
you so much. Yeah, very insightful.
Samir, do you have a question for Omer?
Yeah, absolutely. So, Omer, I would love to hear from you. What are the digital projects that are not facing a patient, that are more inward facing towards your users or operations that you're most excited by?
So it may all sound like a cliche, but it's almost like I had to say, but part of my responsibilities with data analytics, I'll have to say it's the promise with AI, a tremendous amount of promise. So applying artificial intelligence to improve our health, from drug discovery to more efficient hospital operations,
Yeah.
to better diagnosis, right? What we are seeing already in like radiology and other spaces, just tremendous opportunity. And I just feel that we're scratching the surface. And so that's really one key area, and all the value that it brings within.
Wonderful.
All right, very good. I think we have time for a quick last word. So, Omer, let's start with you. Any parting advice for your colleagues in the chief data officer position?
So just I would say a couple of thoughts. So the one, I think, what Samir and I've talked about in way of trends and focus areas from AI, ML, digitization, automation. These are all multi-year journeys and with maturity curves, and they require education of the organization, change management, both from a cultural and process perspective. So it's about getting started. So message would be that if we haven't started in organizations in these areas, then just do it. Just get started. It takes time to get these going. The second one, just want to highlight, that we won't be able to do anything that we do without our team. So our biggest asset are our teammates. And one of the things that we have started noticing recently is the mass exodus because of the pandemic. And we're seeing a lot of people resigning across. I just will just share one stat with quickly with our audiences. It just caught my eye that according to the U.S. Department of Labor, during the month of April, May, and June, a total of 11.5 million workers quit their jobs. And recent studies indicate that it's not over. And more importantly, relevant to us is Microsoft found that 41% of the people are actually considering quitting. And that number actually jumps to 54% when you just focus on Gen Zs. So this is a phenomena that has that will strike healthcare tech, our teammates, if not already. So we just have to be, we just have to make sure that we are really transparent with our teammates and communicate with them very openly and listen to their needs, desires, and grudges if they have, because that's going to be very important. It's very hard to turnover is expensive, and especially when you talk about our area, which is like scientists and digital teammates, it's even more difficult to replace those teammates.
Very good, Samir. Final thought?
Yeah, I think the talent challenges are real, seem to get worse by day, and it'll be years before it gets different. So, fully agree with that. The other thing I would say is that organizations that are taking value-based stance, like my organization took a stance against racism when the George Floyd murder happened. Omer spoke about the disparities in health, which either digital can make worse or can make better. Those are things that I'm very proud to be a part of an organization that has taken a science-based and fighting against racism based stance, and people will look for that when they choose who they work for. The mission of healthcare is no longer just being in a healthcare organization, and it's really important that leaders get comfortable having these tough discussions, being vulnerable, and taking an apolitical but a strong stance against some of these systemic injustices that just seem to perpetuate.
All right, great conversation. Regarding continuing education, you could use the final slide in this deck. You'll receive an email when the on-demand recording of this webinar is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team, and you can go to our website to register for upcoming webinars. With that, I want to thank our panel, Dr. Samir Badlani and Omer Awan, and I want to thank you, our attendees, for coming. And with that, everybody have a wonderful day. Thank you.
Thank you.